Hi, welcome to week 2. We're going to continue on our conversation from the last unit with working with soft tissue. This week we're looking more specifically at dysfunctional movement patterns as it relates to the upper traps and the mid-back. We're going to be looking at trigger points, talking a little bit about trigger points and how that affects the muscles and what you're feeling. And then some other biochemical things that you can do to help with the health of your muscle tissues and your fascia. And then in the following videos, we're going to be doing the work videos, where if you don't want to know all the why we're discussing it, you can skip this video and move right on to the work videos, which gives you the specific exercises that, again, you can build onto the ones that you did last week. So what we're doing is that we're creating a system. By the time we're done all 6 units, you'll have a nice solid system of self-treatment that you can do at any time that you need to. So what we're talking about today is tension pulls and trigger points. So what exactly is a trigger point? Well, it'll be, oh, I have this knot here, or, you can usually find them, especially if it's in your neck, your shoulders. It's going to have a referral pattern as well. So sometimes if you find a trigger point and then you're like, oh, that feels like a knot, and then you can feel it refer onto other areas of the body, that can be a trigger point. It can also be very related to posture. We've talked about posture before. I do feel like I'm nagging a little bit about posture, but it's really important that you work on your posture to help reduce the tension pulls on the muscles. So the muscles have origins and insertions on the skeletal system, and it's supposed to keep you in a particular position, but when you're consistently pulling yourself out of that position, it puts undue tension on those muscles as well. And so then they end up creating compensation patterns and dysfunctional movement patterns, and then can ultimately lead to trigger points as well. So we're talking about a dysfunctional movement pattern, and you may have heard me talk about this already, and you will continue to hear me talk about it. When we're injured, depending on what's happening with the body, it could be from a repetitive movement. The brain is incredibly efficient at creating compensation patterns in the body. There's lots of compensation patterns that just make sense based on synergists and antagonists with the muscles, how they pull, the kind of contractions that they do, all that kind of stuff. However, there's also oftentimes what feels like there's no rhyme or reason to why there's a specific movement pattern. So again, for the purpose of this particular course, we're looking at general patterns, common patterns, and when I give you an exercise to try and do, if it doesn't work for you, that means it's maybe not your specific and unique dysfunctional movement pattern. You can just move on to the next exercise and see if that helps. So a dysfunctional movement pattern means that one muscle will start to compensate for one or more other muscles in a particular movement or kinetic chain. A common pattern that we'll often see in post-concussion syndrome is the upper traps overcompensating for either something in the hips or in the mid-back. Today we're discussing what can happen with the mid-back. How do you know if there's a dysfunctional movement pattern? Well, ultimately, you need to have it specifically evaluated by a practitioner. But one thing you can do is start to play around with different sequences of movements. And we're gonna work with that in the work video. But I'll just discuss with you, oftentimes the upper traps will overcompensate for the mid traps, and then you get mid-back pain and constant tension in through the shoulders. if you have a desk job that you're still working through and you're sitting for a huge portion of the time, oftentimes a common pattern that we find is your upper traps overworking for your psoas. And so if you're consistently getting, massages and that kind of stuff, trigger point release with the dry needling into the upper traps, and it's not working for you, it means that there's some other area of the body that those upper traps are overcompensating for. And that's the second piece of the puzzle that needs to be found. So when we're looking at trigger points, again, it's often, I've got this knot, or my massage therapist keeps working out these knots, or I found this knot. Well, what is that? It can come up from, come up from tension pulls. So again, that posture piece. So if the muscle is pulled out of alignment, it'll create tension. Uneven pressure distribution. So we're looking at if you stand with your hip over to one side, or you're talking on the phone, or repetitive motion. Direct trauma, of course. And the trigger point develops in the myofascial. So the fascia, which is your connective tissue that sort of wraps around everything, keeps you essentially held together. Generally in the center of the belly of the muscle. It can refer pain to other areas of the body. And little satellite trigger points can be found in the fascial lines of stress. So if you listened to the posture lecture, we talked about the fascial system. So for example, you might have trigger points up and through here that refer pain up into the head, but there might be other satellite trigger points all the way down the back and in through the back of the legs, maybe down even to the ankles and into the feet as well. So something to consider. The other things that you can take into consideration when trying to work with the health of your fascial system and your muscles is the things that can prolong trigger points or keep you at a greater risk for experiencing trigger points. So first of all, we have allergies. That creates an inflammatory response. Chronic inflammation people who have chronic inflammation tend to have a higher prevalence of trigger points in the body. Hormonal changes like lower estrogen and low thyroid. We will be discussing at some point the correlation between the hormonal system and post-concussion syndrome. But if your hormones have changed, either based on age or based on injury, then you may notice that you have a higher amount of trigger points in the body that seem to be unresolved. Reduced vitamin C in the body has shown to increase the longevity of a trigger point. Low iron in about 15% of people who have trigger points. A decrease in B vitamins, zinc, and magnesium can all increase the likelihood of trigger points or the longevity of having trigger points. We will be discussing nutrition in the coming units, and we will also have our guest speaker on nutrition and post-concussion recovery as well. So lots of information is coming down the line as it deals with nutrition and what it is that you're going through right now. So that's essentially what I wanted to talk to you about today in our short little why video. Why are we wanting to work on the soft tissues and how? So the work is coming soon. The why is because we've got tension pulls, our posture is shifted, we have chronic inflammation in the body, and as you know, when you've had a head injury, it increases the likelihood of systemic chronic inflammation. One thing I do want to take note of is that in my personal practice, I don't subscribe to the no pain, no gain. So really digging into the trigger points, digging into the muscles, I find tend not to be effective for long-term benefit for those who are experiencing post-concussion syndrome. That's not always going to be the case. Obviously, there's going to be people that technique seems to work really well. But I find in my personal practice that lighter is better, or very specific targeted ways of using direct, more intense pressure in a very specific and targeted way. We will have our guest speaker as well talking. She's an RMT from Alberta, and she's going to be talking to you about soft tissue considerations from a massage therapy point of view. So you'll want to tune into that as well. Thank you. I hope you enjoy the work videos. And again, if you have any questions, always feel free to reach out and ask.